Hey there, everyone. Thanks so much for joining me here on Wave Now. I'm Myra Ansari. Okay, so we are really close to the big solar eclipse. You've been hearing us talk about it. And of course, we've been through a little bit of something similar like this in 2017. We weren't in the path of totality here in Louisville, but we got kind of close. And you have heard us say this over and over again. Do not look directly at the sun. You need to have that protective eyewear. And there is a reason, because if you do look directly at this, you may remember us saying this years ago, you will damage your eyes. So today we are teaming up with Dr. Eren Guner from Norton Children's Eye Care. And what we're talking about today is the damage that can happen, because you know there's someone out there that's going to be looking at that sun and then they're going to be regretting it later. Doctor, thanks so much for talking with us today. So tell us, what are things that folks need to know if they're going to go out and watch the solar eclipse?
Of course. Hello. Thank you for having me. So I want to talk about two myths about the solar eclipse. The first one is people believe that the solar eclipse itself causes some lights that damages your eyes. Actually, that is incorrect. The sun produces those ultraviolet lights which are invisible to our eyes, but in a normal day, we don't look at the sun directly. If you look at the sun directly, you would burn, injure, damage your eyes, but we don't, because it's very uncomfortable. However, in the eclipse, since the visible light is going to be gone, so you are going to be still exposed to invisible damaging light, ultraviolet light. That is how your eyes gets the damage and the injury. Basically, what happens is you have some retina cells. These are the receptors inside your eyeball. They take the light and send it to your brain. And they are tiny, tiny bit cells and very sensitive to the light. And with the eclipse, if you look at the eclipse and the sun directly, you would injure those cells. And we have seen many patients in 2017 as well that ends up injuring their retina cells, which is a lot of the times permanent and causes central black spot in the center of your visual fields. And that is the most important part of your vision for you to read, drive, and see, and do your daily activities. So it is very important not to look at the sun directly. The second myth about this condition is that the sunglasses are safe. Actually, that is incorrect.
Your regular sunglasses. Is that what you're saying?
Yes, sunglasses are not safe to use them in the eclipse. So we recommend everyone to get these ISO approved eclipse glasses. These are 100,000 times darker than the sunglasses, and they are the safe ones to use looking at sun and the eclipse directly. And I also mentioned very quickly about the kids. Kids thinks this is a game. This is a fun activity, and they won't even tell you if they injure their eyes. So we should also be very careful with kids and make sure that they're not looking at the eclipse without protective glasses.
How often do you mention kids, but let's be real, doctor, we also have adults that, will say, you know what, it's not going to do anything. What you're telling us, you're in the pediatric field for children, but this applies to everybody.
Correct. This applies to everybody, from a newborn to a 90-year-old. You can injure and damage your retina, and it could be permanent.
So you were talking about the retina cells. That's what's damaged. Is it literally like you're burning your retina cells? What's happening?
Yes, correct. That excess light and ultraviolet light is too strong for your cells to recover from it. It's basically just like you said, you are burning your cells, just like looking at the laser.
And you've been doing this for quite some time. Tell me some stories of this has happened to people. They've looked at the solar eclipse and then they come to the doctor because something doesn't quite seem right.
Mm-hmm. So the interesting part is the damage might not happen right away. Sometimes what happens is a patient comes to us and with a central blur vision, central dark area, and we look at the retina cells and the injury seems like a laser related or sometimes an eclipse related injury, and we ask the patient, hey, did you look at the sun directly? And most of the time they think about it for a minute and they said yes, we did. I cannot tell you how often that happens, but I always tell my patients, when we talk about numbers, the chances, if it happens to you, that's 100% for you. You're so
it may not. What's interesting, I think, what you said is like you may not see the impact of it right away. Could it take weeks? Could it take months? Could it take years?
Yes.
What are we talking about?
So it depends on the extent of the injury. So you can burn them, injure them right away, but you can just hurt them, and it might take a while for the cells to die and lose their function. So it can happen after a couple of weeks as well.
Okay, so I may not be phrasing this question correctly, but like, how does someone think, well, maybe it's macular degeneration, or maybe it's this, or maybe it's this other condition? It wasn't that. How do you determine that the loss of vision is tied to looking at the solar eclipse?
So the patients, the symptoms does not differ much of the time with the different other types of retinal injuries. However, when we examine a patient, the injury that we see is usually very typical for the eclipse-related injuries, because of your pupil, and when it's in the bright environments, your pupil constricts, it's small, so you see the injury in the very center of your retina. The other retinal diseases, they usually cause a larger area, larger portion of injuries in the retina. But if we are seeing a very central defect, and of course there are some examination methods that helps us differentiate it from other disease, that's usually a sign of a eclipse or sun exposure, or again the lasers.
Okay. So, doctor, if folks, April 8th is approaching, you got to make sure that you have those solar eclipse glasses, the correct kind. Don't get, knockoff things, off the internet. There are, of course, those things floating around. If people don't have the sunglasses, if people don't have the correct glasses, I didn't mean to say sunglasses, but what should they do? Should they stay indoors? Just watch it on TV? What should people do?
Probably they should stay indoors and watch it through the TV. So we also know that the eclipse, those ultraviolet lights, has some effects on the skin cells as well. So I would also, I want to mention about the skin protection is also going to be important. But overall, the safest thing to do is watching through the TV.
Okay. All right. Doctor, is there anything that I did not ask you that you want our audience to know? We hope that people take something away from this message. And you're going to hear from people tonight. And also, as we lead into the clips, they did look at the sun years ago and they have suffered damage. This is real. We're not making this up, right, doctor?
No, this is real, and we should all be very careful.
Okay. All right. Thank you so much. Is there anything that I did not ask you that you want folks to know?
I also want to mention very quickly about, there are some people in our population, they are very light sensitive. Some skin conditions, some eye conditions can make you sensitive to the light, like albinism, like some eye issues. Those people should be extra careful, and they should make sure they have their protective glasses when they want to watch the eclipse.
All right. So will you be watching the eclipse?
Yes, I will be.
With your glasses?
Yes, I have them ready already.
All right, perfect. Thank you so much for your time today, folks. I hope you took something away from this conversation. Get those glasses if you have plans to watch the eclipse on April 8th. If not, hey, tune into us. We're going to bring you coverage throughout the day to bring you all-day coverage of the eclipse, a big historic moment happening here in our area. I'm Myra Ansari with Norton Healthcare. Thank you so much for joining us here today. Have a great day.
Thank you. Have a good day.